Patrick Bateman Case Report. The topic of this case report is the diagnosis of a disorder called antisocial personality disorder in the film American Psycho. When comparing Patrick Bateman's behavior patterns to the behavior patterns of people with antisocial personality disorder, he has almost all of the symptoms. So, in conclusion, Bateman should be diagnosed with antisocial personality disorder and receive treatment. A description of Bateman is a wealthy Wall Street investment banker who lives a double life as a serial killer. Bateman only values his social status and luxury items and will do anything to anyone, including murder, to be seen as the best. The setting in the movie is New York City during the 1980s, and it shows a competitive culture of the richest men on Wall Street living luxurious lifestyles. Okay, so for the diagnosis and context, Patrick Bateman could be diagnosed with antisocial personality disorder or ASPD. It is listed in the DSM-5 that ASPD is a pattern of disregard for and violation of the rights of others. For context, the competitive culture Bateman lives in has a direct impact on his diagnosis. It causes him to have negative thoughts such as self-insecurity and a need to be valued by others, which leads to feelings of self-hatred and eventually his disregard for human life and at times homicidal behavior. So the evidence for his diagnosis can be seen with two symptoms listed in the DSM-5. Symptom 1 being repeatedly performing acts that are on grounds for arrest. And in Bateman's case, it would be the multiple murders he commits. And symptom 2 being having a history of many sexual partners without maintaining any monogamous relationships. And in Bateman's case, he has sex with multiple prostitutes and kills them after. So the best treatment for Bateman would be to undergo cognitive behavioral therapy, or CBT. It would introduce new ideas that his negative behavior toward other people also has a negative effect on himself. It may have some possible ethical problems, though. If Bateman became known for seeing a therapist, it would put him at a disadvantage and bring down his social status, which he cares greatly about. So he probably would not want to do it and would not, or may not, get the proper treatment. Some broader perspectives that are revealed are that Bateman's portrayal of ASPD is exaggerated and extreme, but at the same time being accurate. And also portrayals of disorders in the film, or in film in general, are important because they create better understanding of the dangers of some disorders and the importance of treating disorders. Here are my references, and that is it.